new battle over the president's health care law. Employers nationwide are now asking the Obama administration to grant them special relief in those states that are rejecting federal Medicaid dollars promised under the health care law, which means that many employers in those states will face new health care costs. Joining us to debate this is Dr. Sreedhar Potarazu, CEO of Vital Springs Technologies, and Fox Business Network's Liz McDonald. Lizzie, let me start with you. Explain what the problem is here. There are these 14 states that are rejecting these Medicaid dollars, and so now employers in these states feel like they're going to be left holding the bag somehow?
Yeah, that's right. Under the law, the way the law is written, the employers, if their people who work for them go and buy health insurance on the state insurance exchanges, by the way, the federal government is going to step in and help build those health exchanges anyway in those 14 states that have rejected the Medicaid money for them and other money for them. Basically, those workers, if they go to those exchanges, their companies may have to pay a fine. So we've got the U.S. Chamber of Commerce saying, wait a second, we need to get our businesses exempt under the health reform law from having to pay those fines for those workers who go to buy insurance and coverage under the state exchanges, just like there are other exemptions in the law.
Dr. P., what does this mean for doctors in these states as well as small business owners?
Well, let's start backwards. Small business owners and even big business owners are getting crushed. Every week we're finding out about a new loophole within Obamacare that is raising the cost for employers. 10 days ago, they found out they had to pay a fine of about $65 per employee in order to subsidize insurance companies. Today, we're finding out that in those states where Medicaid is not being expanded, they're going to pay more. So the costs for employers are going up, and there's going to be, if not already, a massive upheaval about their ability to absorb that. From a doctor's perspective, well, I think irrespective of what the employers are doing, you know, the doctors are continually getting crushed right now in terms of reduced reimbursements. Insurance companies are narrowing the networks and the number of doctors that they're going to include, so that also many doctors are becoming employees of healthcare systems today, so that the entire shift in the way medicine is being practiced is changing overnight.
Liz, the rationale that some are using for how to become exempt in these 14 states is that poor people in these 14 states are exempt because they don't have to pay for the individual mandate. So they're saying, why not struggling businesses? Can't they use that same rationale? Can't they get an exemption if poor people can?
Yeah, it's a pretty strong argument. We've already seen under health reform a number of exemptions given already that are expiring for things like restaurants who had offered those cheap insurance coverage for mini-med plans that are outlawed under the new health reform law. They had a time period to basically get rid of those plans and offer better coverage. Now, if the administration does say, yes, we'll give even more exemptions, Allison, that weakens the force of the law. It weakens the credibility of the law at a time when the CBO is already saying, you know what, health insurance premiums will go up across the country on average 10 to 30% on health insurance premiums. So they really need the health insurance exchanges to work. And if the young say to themselves, you know what, we see our premiums going up even more than older people, which is what is expected.
It's predicted, sure.
Yeah, then they're going to say, you know what, we're just going to pay that penalty and not get insurance at all. Yeah. And that means the health insurance exchanges could fail because you have the sicker and the elderly in it. You need that pool of younger workers in there.
Dr. P., is it possible that because of things like this, that Obamacare will just sort of exempt itself into oblivion?
Well, I think we're seeing that already in terms of month by month. There's a number of warning factors. Number one is that the exchanges that have to be up and running by October 1st are far from that. The cost for putting the exchanges up is absolutely underestimated. The states haven't yet quite figured out how to do that. You're seeing a number of new regulations in terms of what employers have to pay. The writing is on the wall that the price tag for Obamacare is completely erroneous from what we've been told. And I think that the Obama administration is now trying to defer the implementation so that the end result and the failures of that don't reflect in either the midterm or the next election. Yeah. So we need to watch that very carefully.
Dr. Potarazu, Liz McDonald, thanks so much for coming in to explain it to us.